So hello and a very warm welcome to today's ISNTD Connect meeting. I'm Marianne Comparet and I'm speaking from the International Society for Neglected Tropical Diseases. And today's ISNTD Connect is a special on the impact of climate change on neglected tropical diseases, which we're holding today on the occasion of the 26th United Nations Climate Change Conference, COP26, taking place right now in Glasgow in the UK. So this past 10 days and the months leading up to them, if not years and in fact decades, have really coalesced an enormous amount of thinking on a global scale around this tremendous topic that is climate change and its impact on human life. And within that, despite the numerous voices and even substantial disagreements spanning the sciences and all the way to the politics, what everyone can agree upon is that the vast majority of the burden imposed by the changes, both acute and long-term in climate, are borne by the world's poorest and most vulnerable. Now, at the same time, as we know, it's those very communities that are most at risk of poor health and in particular, neglected tropical diseases. To be honest, despite these compelling overlaps from the point of view of the affected communities, the health impact of climate change has tended not to be center stage historically. And within that, the linkages with infectious diseases compared to non-communicable diseases have been even further overlooked. So it seems that in order to mitigate the impact of climate change on human health, focusing on the linkages with neglected tropical diseases is not only a priority, but quite a solid strategic route for cooperation, not just on an advocacy level, but at the scientific, research and funding levels, if we truly want to tackle what over 200 scientific journals have come together to call the catastrophic harm to health from climate change. So encouragingly, at a high level, COP26 has seen some 50 countries sign up to the COP26 health program, led by WHO, UNFCCC Climate Champions, Healthcare Without Harm, and numerous other partners. And it's also catalyzed a real drive in the attention given to the direct impact of climate change on diseases. But what do we know in more concrete terms about the impact of climate change on neglected tropical diseases? How are these linkages evolving over time? What are the gaps in these sectors working together? And also, how can those who are inheriting this challenge, namely the youth, mobilize to tackle this global emergency? Well, these are some of the very bold questions that we hope to start unpacking and thinking about, and all that within a rather ambitious 90 minutes. And so to take a closer look at these issues, I'm sure that you will all join me in welcoming very warmly our panelists today, who will be giving us a lot to think about in terms of the science, but also the collaborations and the voices needed to move us closer to the very bold and imperative goals across both the climate emergency and neglected tropical diseases. So I am very pleased to welcome today our 5 panelists. First of all, I'd like to say hello to Dr. Rachel Lowe. Hi, Rachel.
Hi there.
Hi. Oh, sorry, I'm making you all come on your cameras just for these introductions. Rachel, you're with the London School of Hygiene and Tropical Medicine, and within that, the Centre on Climate Change and Planetary Health. We're also joined by Dr. Mark Booth, Senior Lecturer at the University of Newcastle. Hi, Mark.
Hello there.
Hi. Tuning in as well, we've got Aloyce Urassa. Aloyce, hello. You're from the ALMA Youth Advisory Council and you are Chairperson. Nice to see you here.
Thank you. Nice to see you too.
And joining us as head of SADC Youth Task Force on NTDs, SADC being the Southern African Development Community, is Maximillian Godwin. Hi, Max.
Hi, how are you doing, guys?
Nice to see you. And we do have a 5th panelist, who is Rachel Tidman. Rachel is was affiliated with the World Health Organization at the time of the work that is about to be presented, and is now with the OIE, the World Organization for Animal Health. Rachel couldn't join us live, but we're very grateful for Rachel, who sent us a recorded presentation. And so without any further delay, I am going to move on straight away to Rachel's presentation. Rachel and co-authors recently published a paper looking at the impact of climate change on neglected tropical diseases. And perhaps we'll start off with a nice and broad overview on a systemic review of work that's been done assessing these linkages and this impact.
Good afternoon, morning or evening, depending where you're joining from today. I'm so sorry not to be able to join you in person, but thank you so much for the opportunity to present our updates on climate change and the impact that this may have on neglected tropical diseases. Please do feel free to contact me following today's event, and I'd be more than happy to discuss the presentation or paper further if you're interested. So I'm sure you're all very familiar with this group of diseases, but this is the list of diseases classed as neglected tropical diseases by WHO. And you can see here that we have a huge variety of pathogens, many of which don't seem to have a lot in common. What they do all have in common is that they disproportionately impact vulnerable populations in low resource settings in tropical and subtropical areas. Now, these same communities are often suffering the greatest consequences of global change, particularly climate change. We're also seeing displacement of populations, so partially due to armed conflict and political upheaval, but also because of food and water insecurity, which is aggravated by climate change events such as severe droughts. And this displacement, combined with limited resources and health infrastructure, will exacerbate the disease burdens in these communities. And in addition to this, any change in epidemiology and distribution of these diseases may also then put additional populations at risk and undermine any current disease control programs. The WHO NTD roadmap, released earlier this year, sets out targets for the prevention, control, elimination, and eradication of these diseases by 2030. We know that interventions to prevent and control NTDs are one of the best buy-ins or investments in global public health. We also know that NTDs are important traces for identifying disparities in progress towards universal health coverage and equitable access to high-quality health services. However, climate change, along with all these other factors, may change the transmission period and geographical range of these diseases, potentially resulting in encroachment on regions and populations that have been previously unaffected. And in order for this roadmap to have the desired impact, we need to be looking at ways to improve surveillance and monitoring to make sure that we're actually identifying areas of NTD incursion and emergence, and making sure that these are then included in future public health interventions. So we set out to conduct a systematic review of the available literature on climate change and NTDs, looking to identify correlations with climatic factors that influence trends in disease transmission and distribution. We also wanted to identify geographic areas and populations that might be at risk of disease incursion or re-emergence under future climate change scenarios that may not necessarily be included in current disease control and surveillance programs. And the aim of this is that we could potentially help predict disease distribution and improve targeted public health interventions. What we confirmed by this exercise is that there are complex interactions influencing these diseases and these trends. So these diseases vary considerably in their epidemiology and transmission. Some require vectors or intermediate hosts. Many have a range of reservoir species, all of which influence the epidemiology quite dramatically. And of course, climate change isn't happening in a vacuum. It exists in this complex matrix of other factors which further complicate matters. So globalization, changing land use, movement of humans and animals, urbanization and population growth, All of these contribute to changing disease epidemiology. Now, it was unfortunately impossible to isolate specific predictions. They all conflicted based on geographical area, what disease we were looking at, and what vectors and hosts were involved. But we did find some general trends, particularly for vector-borne diseases. And in particular, looking at temperature and rainfall, we found that temperature influenced the lifespan, reproduction rate, and feeding rate of vectors, while rainfall impacted the availability of suitable breeding habitats. We saw anticipated changes in transmission periods and geographical range of many of these diseases, with an overall trend of shifting into higher altitudes and latitudes. We also found that there were possibilities of vector and reservoir species shifting as transmission changed, and the studies we reviewed highlighted the complexity of some of these transmission cycles. For example, Chagas disease, which has a huge number of competent vectors, all of which had varying habitats, a range of different reservoir hosts as well, and varying thermotolerant ranges. And as I mentioned, these are all the other factors as well that feed into these trends. And often the predictions or modelling conducted in the studies that we reviewed didn't include these confounding issues. So it was often very unreliable as to what these trends were doing. For example, we've seen the introduction of competent dengue and chikungunya vectors into Europe following importation of goods. We've seen outbreaks of schistosomiasis in Corsica, France, following movement of infected people from endemic areas. We've also seen local transmission of leishmaniasis in Central Europe, potentially driven by movement of domestic dogs. And things like deforestation and changing land use and housing quality will influence human exposure to vectors for Chagas disease. And these factors often exacerbate the changing trends of disease that we're seeing with climate change. So perhaps they then allow the introduction of vectors or pathogens, which because of the changing climatic factors, are then able to become established and set up local transmission cycles. So dengue and chikungunya really highlights some of the changes that we saw. There was a lot of literature around these diseases, primarily focusing on the changing distribution of the vector. It's very difficult to pin down really precise predictions, as I mentioned in the previous slide, but we did see a few trends happening. So for example, increased temperature could increase the development rate and vector biting frequency and potentially accelerate viral amplification. But past a thermotolerant threshold, increased temperature could then also decrease the survival of vectors. Similarly, although rainfall could increase the number of suitable breeding sites, so could decreased rainfall, which then resulted in water storage behaviours by people. Conversely, increased rainfall could then also result in flooding and the destruction of breeding sites. So it's very difficult to get a clear idea of what the trends were with specific climatic factors. But we did see that potential for a changing geographical distribution, and we have already in fact seen local transmission in previously non-endemic areas, often following the introduction of a suitable vector. We may also see changed seasonal patterns. So warming winter temperatures may mean that instead of having seasonal spikes, we might start seeing disease throughout the year. There was much less available literature on other NTDs, such as rabies and snakebite. There was a possible change in the distribution of rabies wildlife reservoirs. These papers were focused primarily in North America, which doesn't reflect areas where the true burden of rabies is felt, so in Africa and Asia. Snakebite envenomations may also see a range of trends, so increasing temperatures may result in increased foraging behaviour and contact with humans, but it may also drive some species to extinction. Both increased and decreased rainfall, again, were discussed as potential for driving increased contact, making it difficult to predict some of the changes we might see. And of course, this is heavily dependent on geographical areas and the snake species involved. So in terms of consequences, what does this then all mean? So the obvious one is that we might see the incursion and re-emergence into new and naive human populations, resulting in increased morbidity and mortality from these diseases. But it could also mean detrimental impact on control programs. Changes in reproduction rate of intermediate snail hosts, for example, may result in these species rebounding much faster following snail control efforts. Lymphatic filariasis is considered eradicable, but what will the change in geographical distribution do to control programs for this? And we focus very much on human health, but we also need to consider the impact this has on animal populations. Diseases such as trypanosomiasis can have an enormous impact on livestock productivity. And if this was to spread into densely populated agricultural areas, we'd not only see an increase in human cases, but an increase in livestock cases. And this would contribute to the spillover in humans, but also result in significant economic losses and exacerbate issues of food insecurity and malnutrition in communities that are very heavily dependent on livestock and agriculture. So what are some of the things that we can do to manage this and mitigate it? Well, to start with, we need far more evidence. We can see some trends emerging in the literature on climate change and NTDs, but without taking into account all these other factors, we'll be struggling to make reliable or useful predictions. We specifically need evidence and robust surveillance and monitoring in high risk and vulnerable areas. Many of the studies that we reviewed focused on changing disease risk in developed regions, but the predicted impacts in developing tropical and subtropical areas were much less consistent, despite the heaviest burden of these diseases being in these areas. And developed regions are much more likely to have the surveillance systems, the healthcare systems, appropriate sanitation and hygiene, and all these things will likely mitigate the risk associated with vector and disease incursion. In contrast to this, vulnerable populations are more likely to lack the surveillance and infrastructure to prevent and respond to disease emergence due to global changes. So we really need to be identifying these at-risk populations and then building the programs and systems to respond accordingly. And finally, we need to be ensuring that we implement One Health approaches. Many of these diseases are zoonotic in nature and have a variety of reservoir and intermediate hosts and a variety of environmental drivers. So we can't be expecting to address these appropriately without including these sectors in our planning and implementation efforts. Thank you all very much for your time, and do feel free, as I said, to get in touch if you've got any questions. But I hope the rest of your meeting goes well today. Thank you very much.
Well, Rachel's not with us, but in the eventuality that you may be watching the recording, thank you so much, Rachel. That was a really important and interesting overview, not just of where we stand in terms of climate change and a vast array of neglected tropical diseases, but also some really good starting points on what can be done as the NTD research community. And one of the things that stood out was this very simple sentence: we need far more evidence. There is some research linking climate changes to certain very particular aspects of neglected tropical diseases. I just would like to draw your attention to some really interesting papers that have come out recently, one of them being thermal performance of the Chagas disease vector Tritoma infestans under thermal variability. Another group in Brazil was looking at the impact of El Nino on the dynamics of American cutaneous leishmaniasis in a municipality in the Western Amazon. The potential impacts from a group in Kenya of climate change on geographical distribution of 3 primary vectors of African trypanosomiasis in Tanzania's Masai steppe. So lots of kind of very different approaches coming out and building that momentum in consolidating that science base, the evidence for the for climate change actions and policies. And on that note, I'd like to invite our second Rachel Lowe, from the London School of Hygiene and Tropical Medicine and from the Centre on Climate Change and Planetary Health. And thanks to Rachel, we'll be able to zoom in a little bit more on one particularly vulnerable group of diseases vulnerable to climate change, and those are vector-borne diseases. So Rachel, over to you.
Thanks very much, Marianne, and thank you to Rachel for that previous talk. That was really fascinating. So I'm going to speak a bit about the modelling we've been doing on the impacts of climate change on vector-borne diseases. So some of you may be familiar with this visualization on how the global climate has been warming since 1850 through to present day, which is just up to the point where you can see this white circle. So this is a visualization produced by Ed Hawkins at the University of Reading. So each stripe shows the mean annual global temperatures since 1950 through to present day. We can see over the last 30 years or so, we've seen a really dramatic warming of the global climate. And we're now in a situation where we need to take dramatic action to slow this warming. We are going to see the climate will continue to warm. And if the right decisions are made at COP, that can be, and we can keep global temperatures below 1.5 degrees C, then we'll see the amount of warming you see on the bottom of this graph. But otherwise, if things just continue as business as usual, then we'll be seeing some very uninhabitable temperatures, which will be very damaging for our health and the planet. And this 30 years of warming that we've seen has also been accompanied by the expansion of vector-borne diseases like dengue. In the 1970s, there were around 9 countries reporting outbreaks of the disease, and that's increased to over 120. We're now seeing outbreaks in parts of the world which hadn't experienced them for a long time, including in Europe. And we recently published a study where we were projecting changes in the length of the transmission season and the population at risk from both malaria and dengue, two of the most important mosquito-borne diseases. And we found that looking at the scenarios where no action is taken and we see warming up to 3.7 degrees C, then we could see an additional 4.7 billion people at risk of these diseases. Whereas if significant action were to be taken immediately, that number could be reduced to around 2.4 additional billion people. So, of course, it's not just climate that can impact the spread and transmission of diseases like dengue fever. It's also related to population growth, unplanned urbanization, and inadequate infrastructure. We can see from this graphic here is one of the largest favelas in Rio de Janeiro, and you can see all the sort of blue patches on the image are these temporary water storage containers, which are often relied upon during water shortages, which happen quite frequently, and also act as ideal breeding sites for the Aedes aegypti mosquitoes. And these kind of conditions, combined with an increase in extreme and frequent events that we're seeing with climate change, can create the perfect storm for explosive outbreaks. But also the increased volume of international travel and trade, along with the climate crisis and more extreme events, is allowing these diseases to spread further afield outside of tropical and subtropical regions. So in our group at the London School of Hygiene and Tropical Medicine, we've been looking at ways to process Earth observation data and seasonal climate forecasts and combine this with disease surveillance data to co-create decision support systems with stakeholders, in particular countries that would like to build climate resilience to these infectious diseases. This is an example of a dengue early warning system that we have running in Vietnam at the moment. This is through a UK Space Agency funded project. And this is a system where, in collaboration with the health authorities in Vietnam, they provide us with a live stream of dengue data. And we use this in combination with seasonal forecasts from the Met Office to predict the evolution of temperature and precipitation conditions over the next 1 to 6 months. And then we combine all this information in a probabilistic model to predict the probability of outbreaks across the different Vietnamese provinces. And this system is being piloted and used to target resources. We're also conducting research in the Caribbean to understand how sensitive dengue, chikungunya and Zika viruses are to climate and to these extreme events, particularly in Barbados. It was being noted that recent droughts had also been linked or changing the epidemiology of dengue. We conducted a modelling study where, using this information, we tested how these hydrometeorological extremes might impact dengue risk at with different lags. And we found that around 4 to 5 months following a drought event, we saw an increased risk of dengue, but also another increased risk of dengue simultaneous with exceptionally wet conditions. And this kind of information can be combined in an early warning framework, so we can be monitoring the climate conditions in the months leading up to a particular season that we're interested in. And we found that this combination of hot and dry conditions followed by wet conditions gives the ideal environmental conditions for an outbreak of dengue. And we're working to communicate and embed this information within the Barbados Meteorological Services in collaboration with the Ministry of Health. And these findings of how these extreme climatic events interact have been incorporated within the Caribbean Health Climatic Bulletin. So when there is a sort of regional drought followed by a forecast of particularly warm and wet conditions, then an advisory can go out to the countries to be sure to target their dengue control and prevention measures to prevent any additional water storage containers due to drought. So we've been doing a lot of work with our partners in Brazil over the years. This is an example of a dengue early warning system framework that we put together with the Ministry of Health and the Climate Services ahead of the 2014 World Cup. So we combined seasonal climate forecasts with the latest dengue cases available at the time of forecast to produce this risk map to give a dengue outlook, probabilistic dengue outlook, several months in advance. And we've been working to improve this model and think about the way seasonality varies given these different geographical areas. And we've been extending the model that we developed in Barbados, and we found that the relationship between drought and dengue is also valid across the large geographical domain of Brazil. And we found that the drought effect is particularly exacerbated in urban areas, which we also found linked to this increase in water shortages in these areas during drought events. We've been working with the Lancet Countdown in Europe, to produce indicators for climate-sensitive diseases. This here is an example of the malaria indicator that we developed for the 2021 report that was just published last month. So we can see here on a global level changes in the length of the transmission season, and also we've been tracking how this suitability is changing in highland areas, and we've aggregated this by levels of the Human Development Index, and we can see that in those areas with a low Human Development Index indicated by purple on the map, you can see that there really is quite a marked increase in the suitability for climate suitability for malaria transmission over the last 70 years. So this is something that to be monitoring and to be aware of. And we have just launched the Lancet Countdown in Europe, which is a new collaboration really focusing on making the most of the wealth of information that we have available in Europe to produce really region-specific and evidence-based indicators for policymakers and the European Environment Agency, who are one of our main stakeholders. I have the pleasure of directing this new project from the Barcelona Supercomputing Centre, where I will be joining in January to start the Global Health Resilience team. So thank you very much for your attention. I'll be happy to take any questions now or later. Thank you.
Thank you very much, Rachel. It's really interesting to see so many examples of the collaborations needed across different regions to forward this agenda. And we really look forward to seeing all that comes out of your new tenure and very exciting times. And really, you've been sort of at the forefront, a trailblazer, bringing together the fields of climate change and tropical diseases. So it's been really interesting hearing from you, and we can't wait to see more. So thank you for that. Despite all those very encouraging examples, there do remain quite a few gaps in where we can really consolidate this cooperation between the climate sphere and the NTD sphere, particularly given the magnitude of the goals that both of these fields have set in terms of improving global public health, but also achieving sustainable development. And so to take a closer look at what we can do to fill those gaps, I'd like to hand over now to Dr. Mark Booth. Dr. Booth, you're from the University of Newcastle, and you'll be talking to us about how we can get more traction between these two sectors.
Thank you very much, Marianne.
I would like to take this opportunity to describe to you some of my thoughts in terms of why we should and how we could make climate change easier to understand in the context of neglected tropical disease prevention and control. If you would like to get in touch after this presentation, my contact details are on this slide. A good place to start, I think, is with the World Health Organization roadmap, the latest version of which has just been published, and the front piece is illustrated here. How many times do you think is climate change mentioned? It is in fact just 6 times. Here are some excerpts from the document. Climate change alters the epidemiology of vector-borne diseases and the spread of NTDs such as dengue and chikungunya. In the context of human African trypanosomiasis, the document states that it's necessary to monitor the impact of environmental and climate changes. In the context of snakebite, the document states it's necessary to undertake research to understand the impact on snakebite of climate change. Most other infections are not mentioned in the context of climate change, despite the fact that nearly all NTDs have complex life cycles with climate-sensitive stages. Some NTDs are vector-borne, some have intermediate hosts, some, such as the soil-transmitted helminths, have free living stages in soil. Climate-sensitive stages of a parasite's life cycle are acutely affected by local environmental conditions. Changes to the biotic and abiotic properties of the parasite habitat will affect the parasite's metabolism, natural history, and survival. Changes to the natural history of climate-sensitive stages are likely to have profound effects on where and when infections are transmitted in the future. Looking a bit further into the roadmap reveals a statistic that may explain why climate change is barely mentioned. One of the main targets of the roadmap is that by 2030, 90% of people requiring intervention will have been helped. Given that climate change is often thought of in terms of decades, it would appear from the roadmap that there is no need to worry. To achieve the stated aim, there are a number of assumptions that must remain fulfilled until the end of this decade. Some are explicitly mentioned in the roadmap, some are implicit. In summary, there should be no disruption to current or planned interventions. Secondly, the workforce required will be available until the job is done. Thirdly, medicines will reach the people in need until the medicines are no longer needed. And finally, all other things should remain equal. Unfortunately, there is already evidence that these assumptions no longer hold up. On this slide is an infographic published by the World Meteorological Organization regarding climate risks, extreme events, and related impacts. We know that extreme weather, including prolonged droughts, more frequent floods, are already occurring. We know that millions of people in vulnerable areas face internal displacement. We know that infected individuals can carry their infections as they migrate, and I will show the evidence of this in a few slides. We know that uninfected individuals can move to an area where there is a hazard and become infected. We know that new foci can emerge when infected people move to a new area. And it's also plausible to suggest that established foci may disappear when, for example, people desert their community because the habitat is no longer suitable because of the climate crisis. Now let's look at the evidence. We know that historically people have migrated for many reasons. This map illustrates migration pathways within West Africa, from West Africa to Europe, from South America into North America. In this case, these migrations have been ascertained to be caused by the climate crisis. Now, for example, West Africa is known to be an area where many NTDs are endemic. It is therefore plausible to suggest that some people will carry their infections to new areas. If this happens, outbreaks may occur. Is there actual evidence of this happening? Yes. The literature contains several reports of outbreaks occurring in previously unaffected areas or areas that have previously suppressed the infection. So, for example, in 2013, there was a report of an outbreak of schistosomiasis on Mafia Island in Tanzania caused by imported infections. Similarly, in 2013, there was an outbreak of schistosomiasis in a non-endemic area of Brazil. Earlier than that, there was an outbreak in the metropolitan area of Belo Horizonte caused by tourism. More recently, there was an outbreak of schistosomiasis in Corsica, which was ascertained to have been caused by an infection migrated from West Africa. And in the same year, a report of an epidemic of schistosomiasis in recent immigrants to Italy. Now, what I have just told you demonstrates something that I think is quite straightforward to understand. It is clear that the climate crisis is forcing migrations. And I've shown that people who migrate from endemic areas may carry their infections along with them and causing new outbreaks. It's therefore plausible to suggest that the climate crisis will cause new foci to emerge in the near future. These are contemporary problems. They are happening now because of the climate crisis. So why is it so difficult for the World Health Organization to consider this problem in more detail in the roadmap? Why does the link between NTDs and climate change remain intractable to a large organization that contains departments on climate change, migration, and NTDs? One reason, I believe, is that different stakeholders can have very different perspectives, and these different perspectives are very difficult to align. So, for example, climate change is often projected over the whole world by organizations that model how the global climate system might change. Many scenarios are typically presented to cover all eventualities. Some models employ what is known as downscaling to project what might happen over relatively small areas. Alongside global projections, the models also tend to project over many decades. In this bottom panel, we see one such projection of rainfall which extends to 2080. The tension arises here because of differing perspectives by those experiencing NTDs. First and foremost, NTDs are personal health problems that may be experienced acutely or chronically over many years. Secondly, NTD transmission may vary considerably over small areas, well below the resolution of downscaled projections of climate models, and infect people on a seasonal basis. The example here is for annual cycles of dengue. Another reason why climate change remains difficult to understand in the context of NTDs is that no single stakeholder has a wide or deep enough perspective that takes in all the perspectives of other stakeholders. So any person or organization that is trying to understand how they might be affected by NTDs in the context of climate change has no single authoritative source of information. Let's look at this problem in a bit more detail. We have already heard about the World Health Organization. They have departments of climate change and NTDs, but do not cross over within the organization. Companies have a duty to protect the health and safety of their employees, but may not have in-house expertise on either climate change or NTDs. Governments have a duty to protect their citizens and may have experts in climate change and NTDs, but do not bring them together because, for example, the roadmap does not prioritize that kind of partnership. NGOs are working in the field with vulnerable people so they can gain personal perspectives, but most likely do not know how to advise their constituents about how climate change may affect their exposure to NTDs in the near, mid, or long term. Academics can and do research the link between climate change and NTDs, but lack the perspectives of governments, NGOs, and citizens outside the context of their own research. Individual citizens will vary considerably in their knowledge of climate change and NTD transmission, but are often the most vulnerable and least well-resourced to mitigate or adapt as necessary. Not only does each stakeholder have limited perspective, but they are also each undertaking different missions with different priorities, different agendas, etc. Each of them is affected differentially by the availability of resources. They may be affected differentially by the natural world, which is changing at an unprecedented rate, and they are often working to different timescales. The end result of these partial perspectives, competing agendas and differential effects of time, resources, and the natural world, is a jumble of words, warnings, advice, conspiracies, recommendations, etc., that makes the whole issue almost intractable. So what can be done about that? You may have heard me reference just now that no single organization has a sufficiently authoritative voice. So what I am proposing is that such an organization is formed. Individual stakeholders would approach this organization, for the sake of argument, let's call it the Global Advisory Group, and ask the group to give them a view on how climate change might affect NTDs in the stakeholder's own context. So, for example, a company may want to know if they should put in adaptations and develop practices that are climate-proof to protect their workers from one or more NTDs in the near, mid, or long term. This Global Advisory Group, which is objective, non-partisan, and apolitical, would have access to the entire corpus of information on both climate change and NTDs. They would draw upon that corpus to provide authoritative advice to the stakeholder so that the stakeholder could then make an informed decision on next steps. This slide suggests one way in which the information delivered to the stakeholder could be delivered in a tractable way. Imagine that the Global Advisory Group is able to dissolve and remove all the confusing messages and instead present a single message that is centered on the risk to the stakeholder. Risk itself is composed of different components defined here. So there is vulnerability, which is defined as being unable to cope or anticipate. Hazard, which is defined as a loss of health infrastructure, services and resources, and exposure is defined as adversely affected services, functions, resources and assets. The Global Advisory Group could weigh up how each of these components contributes to the risk for each stakeholder in each location. The calculation of these weights would require inputs from a number of sources, and these would be members of the Global Advisory Group. Notably, risk is a term that can be scaled from individual to institutional level. Notable also is that climate change is now one of many subcomponents, as the Global Advisory Group will be able to weigh up the influence of that issue alongside other parallel or competing components. What the stakeholder would receive is a simple to understand assessment of risk to their constituents. In the example of the company seeking advice, the decision to act would be based on the risk level. For example, if the risk level was high, the company could ensure more medicines are available to their employees and/or develop mitigations within their working practices. So, in conclusion, information about climate change and NTDs is scarce in the World Health Organization roadmap. The global situation is changing rapidly and could disrupt efforts at elimination and eradication. Individual stakeholders lack sufficiently deep or wide enough perspectives to make the right decisions on prevention or control in the context of a changing climate. And I suggest that a new global advisory group could translate, simplify, and improve understanding of how climate change affects risk in the context of NTD transmission and offer insights into which component of risk is most influential. And by doing that, stakeholders would have a clearer understanding of risk and could then take informed decisions on protecting and treating their constituents through adopting mitigations and/or adaptations as necessary. Thank you very much for your attention.
Well, thank you very much, Mark. The conversations around climate change have focused a lot on rhetoric, but also on the need to have practical and concrete steps to tackle it. And you've given us just that. I think maybe we're facing quite a historic moment right here on ISNTD Connect. Maybe this is the birth of the Global Advisory Group on Climate Change and NTDs. And I'm sure if anybody who's listening would like to get involved, perhaps we can encourage everyone to get in touch with you and see where we can take this. And it seems definitely important to focus and center climate discussions around neglected tropical diseases, not just because of the communities affected, but also on a very practical level, the numerous and many networks going into communities, and also perhaps just providing some of the data that's needed to really quantify the impact of climate change or any progress made. It doesn't all have to be meteorological indicators, and some of these proxy indicators coming out of very poor or very vulnerable communities could be a really good metric to measure progress in climate change. So thank you very much for these really practical solutions and thoughts, and we're probably going to be able to put some of those immediately into action with our next two speakers, representing that generation who is inheriting all these problems, namely the youth, so kind of the world population under 26 years old. Thanks to Greta Thunberg, the youth and climate action have become almost synonymous. In fact, you may all have seen that just recently, just today or yesterday, it was announced that the youth have actually put forward a legal petition to the UN. So they want to take the climate crisis up to the UN. They want the UN to make this a level 3 global emergency. So level 3 being the highest level. And even Barack Obama was saying, stay angry. And the role of the youth in this kind of movement is really paramount and has a lot of wind in its sails. And at the same time, in NTDs, we've seen exactly the same thing coming out of the work of Maximillian Godwin, coming out of the work across malaria from groups headed by Aloyce, Urassa. And so it's really exciting, I think, to conclude this session of having the last part really focusing on what the youth's been doing on NTDs and what can this mean for climate action. So I'll hand over to Maximillian. Max, you're representing over our talk today, you're representing the SADC Youth Task Force on NTDs. Just to remind everyone, SADC is the Southern African Development Corporation and represents 16 youth parliaments, so quite a broad reach there in terms of, sorry, I've lost my tab now, quite a broad reach in terms of the youth that you're able to engage as part of your work, but also reach to in terms of advocacy, communication, and involvement. And so we'd love to hear a bit more about what you've been doing and also how you feel you can weave this work into your existing program. So Maximillian, over to you. I can launch your presentation from my side if that helps at all.
Just launch that, no problem. Yeah, so thank you so much. I'm Maximillian Godwin. I'm the head of SADC Youth Task Force on NTDs and Malaria. And I'm so happy to be joining you here today and present what we have been doing, what we think with regard to the COP26 occasion that is taking place right now. Yes, next slide, please. So South Africa Youth Forum is a regional development platform for youth in Southern Africa development community to contribute to more sustainable and effective youth participation. Next slide, please. So the SADC, so now in SADC youth, we have this SADC Youth Health Committee, and within that we have this SADC Youth Task Force on NTDs. So the SADC Youth Task Force on NTD is a group of young people under the SADC Health Committee from all SADC member states assembled to address neglected tropical diseases. So it was formed so as to increase the Health Committee focus on NTDs and highlight areas of NTDs that needs the most and immediate attention. So on behalf of the SADC youth, we are so proud and we commend the efforts that has been shown by the world leaders in preventing dangerous human interference with the climate. We remain committed to our capacity as young people and to abide and champion the COP26 resolution in our SADC region. So neglected tropical diseases are the diverse group of diseases that continue to affect over 1.7 billion people, climate change, over 1.7 billion people. Climate change is having an increased impact on public health in tropical areas and across the world, and can affect disease distributions and transmission in potentially diverse ways. The COP26 is reminding us to improve our understanding on how climate changes influences NTDs so that we can identify populations at risk to include in our future public health interventions. Climate change may influence emergence and re-emergency of multiple NTDs, especially those that involve a vector and intermediate host or transmission. With the climate changes, the regions and populations that were previously unaffected may be in great risk of being affected. Many NTDs results from diverse type of interaction and often complex of transmission and the complex cycles of transmission between human and other animals. Both vertebrates like dogs, livestock, snakes, and invertebrates like mosquitoes, flies, and snails. All these can be influenced by changing environmental conditions such as variations in temperature, rainfall, humidity, and extreme weather events. Climate factors such as temperature and rainfall can influence disease epidemiology, with temperature influencing vector production, metabolism, and survival, pathogens, replication, and vector and host distribution, while rainfall can determine the sustainability of habitats from vectors and hosts through breeding sites. The recent WHO roadmap sets out global targets for NTDs prevention, control, elimination, and eradication by 2030. Hence, the Planning and implementation of NTDs programs should also address the climate changes, for nearly all NTDs life cycle are sensitive to the environmental factors. Through the Environmental Committee, SADC Youth Forum is insisting youth leaders in all SADC countries to take action on climate change, mitigating and adaptation. The committee promotes education, awareness raising, and behavioral change campaigns. Also, SADC youth promote and facilitate engagement in climate projects within different national and international organizations. SADC Youth Forum insists young people to play a role in protecting and improving the environment. They can make homes, schools, and youth organizations more environmental friendly by adapting environmental friendly practices, recycling of different materials, as well as preserving resources such as water. SADC Youth commits to ensure the planet is habitable to those that comes after us. That's why we promote the Green SADC, Green Africa, and Green Planet. This is our coming campaign that is going to address the climatic change, that we need to have a Green SADC, a Green Africa, and a Green Planet. And SADC Youth Forum commits to ensure the planet is habitable for those that comes after us. Thank you so much. It has been very engaging. So for most of the things that SADC is doing, you can kindly visit our Twitter page, SADC, or you can kindly contact our regional coordinator or our team so that we can keep the contact and share most of the things that we are doing. And you're also welcome to follow me and have some sort of interaction soon after this session so that we can keep on interactions on the kind of work that SADC is doing. Thank you so much for listening, and I'm looking forward to have an interaction and answering some of the key questions that you have asked concerning what we youth think with regard to the climate changes and neglected tropical diseases. Thank you so much.
Thanks, Maximillian. We are always quite inspired to hear of your efforts and your ongoing projects, and we've done a lot actually with the SADC Youth Forum. I'll post some links to some of the topics we've discussed, which really gives a good insight into the energy that's coming out of the youth movement. Let's just remember that about 60% of the African population is under the age of 26, so really a very big force for change there. But I'll hand over straight away to Aloyce, and we'll hear a little bit more about what the youth is doing in the field of malaria, and particularly the recently launched Malaria Youth Army. So kind of very strong vocabulary there to translate that energy coming out of your group. So Aloyce, over to you. I see your presentations come up nicely, so I'm just going to back out.
Oh, thank you very much, Marianne, for inviting me to speak in this occasion. It's really an important event for the world and for everyone from every level, from the global level to the community level. So as introduced, my name is Aloyce Urassa. I'm currently a chairperson of ALMA Youth Advisory Council. Gladly that I've been working with Maximillian as well in SADC, where I've been co-chairing the Environment and Climate Change Committee, where we had over 10 key asks on environment and climate change. And one of the key asks was on the impact of climate change to healthcare systems. And our key asks were submitted through a declaration to the SADC Secretariat, which was presented during the SADC Forum. ALMA, going back to my presentation where I'm representing ALMA Youth Advisory Council. ALMA is a coalition, an abbreviation of African Leaders Malaria Alliance, a coalition of 55 AU member states, the head of states, and championing to end malaria in Africa. It was launched in 2009, and up to this moment, ALMA has been doing a lot in fighting against malaria and promoting universal health coverage. The Youth Advisory Council was established to champion for the youth youth engagement in the fight against malaria and universal health coverage promotion. And currently we are supporting the countries, the African Union member states, to establish youth armies to increase or to reinvigorate the fight against malaria and to drive up the promotion of universal health coverage. Today I'll be talking on the three outlines: climate change and health, and I'll be highlighting the untapped potentials of African youth. And I'll talk about the youth engagement in climate change and health advocacy with reference to Malaria Youth Army. It is really tragic to see diseases like malaria killing so many people, over 400,000 people per year, as per WHO reports in 2020. Trachoma, paragonymous cysticercosis, schistosomiasis, lymphatic filariasis, leprosy, leishmaniasis, fascioliasis, rabies, chikungunya, and many other NTDs. Some of these diseases, it's funny that they were there even before Christ. Unfortunately, this disease keep on becoming stumbling blocks to development and to hindering lives of many in our communities up to this moment. It is real time for us to optimize our behaviors, to optimize the way we act with the environment, the way we treat the trees, the way we treat the oceans, the way we treat the land. It is really important that we optimize everything so that we really pay the debt that we owe to the world. As Mark was speaking and mentioned some very important areas of partnership in order to ensure that we achieve what we are speaking about. On our side as young people, we call for action now. It is not time for promises anymore. It is time for practices. It's time to stop the discussions and start acting, doing more actions. We have a lot of plans, we have a lot of policies in hand, but what about the implementation? So as young people, we are calling for engagement, not just to come and speak, not just to come and discuss, but we want to take action. We want to really make a change. We really want to mitigate this climate change. We already have a proof that climate change affects our lives. Climate change affects everything, affects nutrition. Climate change affects the way we deal with every situation. When the situation is too warm or too cold, it's already a problem. And we have the chance to make a change. We are the ones to make that change. So as young people, we are really up to that, to making that change. Well, climate change and health. Human populations are being displaced in sub-Saharan Africa, Southeast Asia, and Central and South America. This is due in part to armed conflicts, yes, and political upheavals, yes, in some areas, but also to food and water insecurity caused by climate change, such as severe droughts, as I said before. Devastating effects of climate change put together with poverty and limited health resources and poor infrastructures, and now we are talking of COVID-19 effects, will definitely exacerbate current disease burdens such as malaria and NTDs, which already disproportionately affect the poorest. So what are the untapped potentials of young people in Africa, and particularly in Africa, where we're working with the Youth Army? Young people are potential champions to advocate for change. Young people know what the community needs. And as Marianne said earlier, that over 60% of the African population is under the age of 26. It is imperative that we engage actively this community. And currently we are talking of the sustainable development. There is no sustainability if young people are left behind. There is no sustainability at all. So we are calling up the global communities, championing for everything that matters in our community, to engage young people actively because they are potential advocates and they know what is required at community level. Young people can be communicators for change. Young people can call up a strong community engagement and actions. And this has been proved from the stories of young people, from over 2,000 a group of young people we have in ALMA as youth champions have been proving through their stories. Some of them have been distributing mosquito nets to many people who earlier had no access to getting these nets. I know, yes, in many governments there's a massive distribution of mosquito nets, but there are some places which are missed because of maybe transport, poor transport facilities, and sometimes lack of data about those places. Young people are coming up as innovators, are coming up with creative ideas. We have seen a lot of potential platforms, creative ideas to engage the community. Recently, I attended one of the launch of a film, an animation by young people in Tanzania, and the Mbuland. They're trying to simplify knowledge transmission to the community through animations. People making it easy for people to understand effects of malaria and prevention ways. Young people are really innovative. I've seen an over 6 years and up to this moment in Uganda, the Matibabu initiative, coming up with a diagnostic service on malaria without taking blood. These are really innovative ideas that are coming from young people, and many other things that young people are doing. Unfortunately, many of these initiatives are just taken lightly and not really incorporated into action and fully supported to operate. So it is really time, and this is the future is now. We say the future is now. It's a really high time to tap up these potentials and engage young people as active change makers, as equal partners in championing for change. The guiding principles for youth engagement, with reference to our currently established, youth army, Malaria Youth Army. One of the guiding principles on advocacy. There's been no better time for young people, for the young generation to advocate for their own future. Now it is time to own the climate change and health agenda. Action, no matter your age. Now this is directly to the young people who are present in this occasion. No matter your age, no matter your experience, you have the power to make a difference. And we can be the generation to realize climate justice. We can be a generation to end malaria. We cannot be a generation to beat NTDs once and for all. From one village, one country, one region at a time. We are good communicators. Young generation of today has never been better at communicating. Now it is time to leverage the global power of digital communications to increase awareness about urgent climate change effects on public health. Innovations. If we are to achieve universal health coverage, young people must keep engaging in scientific research and innovative strategies, because we must always be one step ahead. The ALMA Youth Engagement Strategy from 2020 to 2030, which we're implementing now through our Youth Advisory Council, calls for more partnerships, calls for more engagement, calls for more digital inclusion and training for young people. And currently we have an opportunity for young people to learn on our current scorecards. And scorecards gives up-to-date information on many diseases, including malaria, NTDs, also health-related issues like maternal and child health, adolescent health. So young people have chances to learn for free from our platforms. If you go to our website, alma1030.org, you go to the scorecard hub, you'll find an IAC, ALMA Youth Advisory Council training on the scorecards. You can learn a lot there, and you can interact with us to learn more. This is a team of Youth Council, 11 from representing every region of Africa, where I serve as the chairperson. We have the vice chairperson, we have the secretary, we have the leads from every region of Africa and from the diaspora as well. So you can engage with us through our platforms, and we can do together more and more. The Malaria Youth Army Champions, we had over 2,800 applicants, and this came from 38 countries. We are going to have some trainings with them, training sessions with them this month, and so many engagements. So I call up the ISNTD and many other organizations who are here. If you really wish to engage young people, then we have the team for you, a ready team, very vibrant team. You can engage with us at any time. So thank you very much, and I'm hoping that this is not just the end, but the beginning of more and more and more. We don't need, well, yes, we can say the COPs, the discussions, dialogues, and so on are really important, but those alone are not enough. We need to come and take more really actions into the ground to achieve universal health coverage, to achieve an end to NTDs, and achieve an end to malaria. It is really my hope that one day we shall make it. Thank you very much, and looking forward to answer any questions if they'll be there. Thank you. Back to you, Marianne.
Thank you, Aloyce, and what an exciting way to wrap up the presentations today at this session. That's been really inspiring, and it kind of ties in a lot of the things that our many speakers have said today, starting right at the beginning with Rachel Tidman's presentation, where she really urged us, saying that we need far more evidence. And it seems that your youth group and the way you've engaged with them already on infectious diseases would be a great opportunity to really roll out citizen science and gather all that granular data that's needed, and take that in terms of linkages all the way up to the high levels, to the advocacy and so forth. And perhaps having heard all your presentations today, and by the way, again, a very huge thank you, a very big virtual round of applause to you all. The first thing that kind of strikes me is we've heard a lot about how health has not necessarily been put center stage in terms of climate change and climate discussions. It has tended to come perhaps as an afterthought, although that is now changing with a lot of momentum gathering and a lot of big institutions putting their weight behind this. But at the same time, within our NTD and health kind of networks and systems, perhaps climate change itself has been considered a bit of a secondary issue or not an immediate one. So if we really want to bring those two together, and we've heard why this is absolutely urgent and paramount, really we need to have a better, perhaps, lingua franca, something that connects the two much more closely. And so my first question to our panelists today, and I see Rachel had to leave, so unfortunately she's not connected at the moment, but Mark, Aloyce, and Max, perhaps I'd like to ask you first, how do you feel we could best bring together the two sectors? What do we need to do so that we can both speak the same language, whether it's at the advocacy level or whether it's down to the kind of basic science of the indicators we're looking at, the data, the results, and so forth? Mark, please feel free to go first.
It's a simple question, but I think the answer is not at all simple, really. A number of years ago, neglected tropical diseases themselves were so neglected, no one knew about them. The people who were affected didn't know about them. There were very few NGOs interested in tackling them. It was the introduction of investment, a change around in WHO, and gradually things started happening. There were more NGOs appearing who were absolutely interested in eliminating NTDs, and they started producing literature and terms and making resources more freely available and educating people in a way that they would understand the complex situations that they'd never come across before. And I think something similar has to happen in terms of climate change and NTDs and linking them together. It has to be a kind of general movement that is informed by as many stakeholders as possible joining together, putting their voice forward and saying what they want to know, what they don't know, what do they, and then putting that around in such a way that it means there is a new language appears, that people become comfortable with using. I think at the moment it's so specialized. You hear it's very difficult, I think, for non-academics to understand an academic paper on climate change. And one thing that has to happen is a translation, a kind of a global translation of what's going on at these very kind of, to use a metaphor, stratospheric levels of engagement with the subject. If you go to the any website that's devoted to climate science, it's impenetrable. If you read the IPCC reports, they're impenetrable. They go on for thousands of pages, and they're impossible to get through unless you have a good physical understanding of climate science. And that's so far removed from what people need to know about what's happening here and now, what might happen to them in the near future, I think. So there has to be a substantial effort to bring that information, to translate it to the point where people understand and can talk about it freely and fluently. In the same way that NTD, the knowledge about NTDs has been raised by introducing the subject in such a way that it becomes more accessible and available. And those two things have to be brought together somehow.
Yeah, that's really interesting. And so again, time for the science communicator to step in. And in the chat, Stephen Brahma has given a great metaphor of the boiling frog that if you throw into boiling water would jump out and save itself, but when placed in increasingly lukewarm water will just adapt and get used to the situation. So a good analogy for the climate crisis. And as you say, Mark, by kind of making all these things more accessible and with a direct understanding of the impacts to specific health outcomes, whether it's at the individual level or whether it's even for those organizations trying to reach those goals, then suddenly the reprioritization of climate and health in kind of the same discussions will be facilitated. So thank you for that. Rachel, I'm so happy you're here for a few minutes. Perhaps if you wanted to give us your final thoughts on any ways in which, given your kind of vast experience of working with both sides of the equation, what needs to happen to bring the two sectors together?
Yeah, I think it's just creating space for dialogue and partnerships between different communities. So not, I assume you're referring to climate change and neglected tropical disease communities.
Yes, sorry, that's right.
So yeah, and also thinking about all those different partners in between that are needed to implement mitigation adaptation strategies to build climate resilience. So, you know, also disaster risk management, sort of hydrologists, or bring in the whole sort of range of different policymakers, data scientists. You know, we need a lot more capacity really to understand at the local level, to bring together all these data sets and to make sure that we have can build the most robust evidence to understand the links between climate variation, climate change, and the distribution of neglected tropical diseases. So yeah, I think it's really building up those partnerships and making sure that those sort of high-level memorandums of understanding between policymakers to really work together and make sure, you know, there's that space to be able to prioritise this area to build climate resilience to against tropical diseases.
Brilliant, thank you very much. And Rachel, I know you've got another meeting kind of backed up, so we'll let you go. And again, a massive thank you for your contributions to today. It was lovely to see you again. And yeah, please do update us on your new position. And we're looking forward to all these exciting projects coming out of there. So thank you, Rachel.
Thank you so much, and thanks so much to my fellow panelists. It was really great to be alongside you today. Thank you. Bye.
Bye. And so, sorry, I just thought I'd pause there to say bye to Rachel, but Aloyce and Max, so obviously you are in constant dialogue with the youth, and do you think that we're speaking to them? Is there anything that could be done differently just to make sure that both the climate change and NTDs is a relevant and urgent cause, kind of right at the forefront of their concerns?
Yes, thank you, Marianne. It's really, I think it's really important to have some more stronger intersections between the global organizations and youth. And as Rachel was mentioning about strategic discussions and dialogues, among partners is the same, that we should treat young people as strategic and important partners in the areas of climate change and NTDs, as well as engaging or updating them with relevant information about NTDs, what is happening, what can be done, and building capacity for them to know, to understand the impacts and think up on coming up with creative ideas of what can be done. So with the ISNTD, I think we can come up maybe with a platform with important information on the intersection of climate change and health, climate change and NTDs, climate change and malaria, climate change and and many others, so that young people can access this platform, get some concepts, and so that they can come up with their concepts from that. So that's briefly what I can share for now.
Thank you, Aloyce. And what's been really exciting actually about the climate movement is that it's really, to be honest, been the way it's climbed up the media sort of coverage and up the agenda has really been driven by the youth. That is one thing that's really stood out from the climate crisis. And so when it comes to putting the communities at the center, which is a point that's being made by Martin Coleman in the chat, Martin says, bringing NTDs and climate change together. To do that, we need to put communities at the center and indeed have them lead. Well, I feel like the climate crisis is really a great example of that happening, and bringing in all the other issues around. We can learn a lot from this movement. So that's one good point. I think we'll all agree on that. Max, what would you like to add, please? Yeah,
sure. Thank you so much for an opportunity to add something with regard to what I've presented earlier. So at my side, I would wish that youth should be engaged all these things at once. We shouldn't engage youth with regard, let's say, to malaria only or to NTDs only. We should have a single approach that can address these challenges that are affecting the world currently altogether, so that youth may know on how to arrange themselves on tackling these health challenges that are facing us. So you may find that some other youth in health they're doing in the advocacy, but they may not consider, but you may find that they are not considering doing anything with regard to the climate changes. So that's why we are saying that the COP26 is reminding us to position ourselves that everything that is happening in our world is affecting the full system and everything. So that means we need to have a single approach that can address all the challenges we are facing, and youth should be engaged in that single approach, so that we can position ourselves in a better way to save us. Yeah.
That's really fantastic, and I hope that message is heard loud and clear. This meeting, this webinar was really just kind of a starting point. We wanted to touch on some of the burning issues around climate change, and particularly how this affects neglected tropical disease, which is really what our network is primarily concerned with. And I felt it's been really hugely interesting to hear from all your different approaches, and also all the different suggestions as to what needs to be focused on in this moment, which in a way is quite embryonic for climate change and health, sort of global health coming together. We've got some great thank yous here from our attendees. Claudia Paredes, hello Claudia, saying thanks everyone. I've enjoyed the presentation, deeply inspiring. Mohammed Juman, hi Mohammed, thank you all for a very informative discussion. And certainly what we can take from this is that it's definitely an inspiring topic. It's something very close to a lot of people's hearts. We've seen that in Stephen Brema's comments, many of them in capital letters. Julia Holder is saying maybe nonviolent direct action may be needed. So definitely topics and subjects that elicit quite a lot of interest and passion. And I hope we can continue this discussion. We've been given a few very concrete steps and a lot of food for thought around this. And so please do watch this space. We'll be bringing more researchers and more colleagues together, and looking forward to seeing where Mark's Booth's suggestion of a global advisory group on this, and also changing the language and how we advocate about all this, how all this is going to come together, and hopefully very rapidly. So as our webinar comes to an end, I'd like to say another very big thank you to all the speakers who are still on screen, and to both our Rachels, Rachel Tidman and Rachel Lowe, who couldn't be here until the end. Thanks to all of you. Thank you, dear attendees, for tuning in today. And we really look forward to seeing you very soon on this platform for some further discussions. So until then, take care, everyone, and thank you for your attention today.